Distinguished ladies and gentlemen, there is no time than now to raise awareness on the importance of physical activity in the fight against non-communicable diseases. The rising tides of NCD requires urgent action at all levels, and promoting physical activity plays a pivotal role in both preventing these diseases and improving mental health. We know beyond doubt the physical and mental benefits of physical activity, but walking and cycling are serving as key sustainable means of transport, which is so critical as we fight climate change. Indeed, physical activity is a policy win for people and for the planet. The WHO Global Action Plan on Physical Activity, known as GAPA, set out clear roadmap of policy actions for all countries, including countries, those in African region, where we are already witnessing the impact of changing lifestyles on levels of physical activity. Monitoring progress of countries implementing GAPA is vital, and therefore the new report launched today is a welcome development. The report has clear recommendation, particularly the need to conduct national community-based campaign to enhance awareness and understanding of benefits of physical activity, as well as the need to implement mass participation initiatives in public spaces to provide free access to enjoyable and affordable social and cultural appropriate experiences of physical activity. It is our view that more needs to be done to regularly promote and engage people in fun and enjoyable ways so they engage in and sustained physical activity. To intensify the efforts to tackle non-communicable diseases through the promotion of healthy eating and physical activity, Botswana has just concluded a long week campaign dubbed Walk for Life campaign, championed by Minister of Health, Dr. Edwin Dikoloti. The campaign serves as a practical demonstration of the importance of the physical activity in our everyday lives. That notwithstanding, we know campaigns are not enough on their own. We must collectively provide a better, safer environment that enables people to be active in their local communities, for children to play and to be involved in active sports, as well as for adults of all ages to be actively engaged in physical activities of their choice, for safe walking and cycling for everyone. It is in that regard that we highlighted efforts to design our streets such that they are better and safer for walking and cycling. It is of utmost importance, particularly in Africa, where we continue to experience heavy death tolls on the roads, with many of the victims being pedestrians and cyclists. The report is welcomed, and we look forward to working with WHO and all of you to ensure we learn from the report that over the next 8 years, we make great progress towards 2030 targets. I thank you.